Hello, and welcome to the September edition of Sepsis Chatter. Today, we will be discussing septic shock, repeat volume status and tissue perfusion assessment performed. This presentation is based upon the specifications manual for the National Hospital Inpatient Quality Measures, Volume 13, discharges July 1st through December 31st, 2023. However, please refer to the specifications manual that applies to the time frame of the period that you are reviewing your records. I'd like to take a quick look at the goals of this presentation. The attendee should be able to recognize if a repeat volume status and tissue perfusion assessment needs to be performed. Calculate the acceptable time frame that a repeat volume status and tissue perfusion assessment is required to be performed. Determine the acceptable documentation that meets this data element. And finally, choose the correct date and time to abstract the repeat volume status and tissue perfusion assessment performed. Anytime septic shock is present, crystalloid fluid administration and a follow-up evaluation of the patient's hemodynamic response to those fluids is warranted. This evaluation, the repeat volume status and tissue perfusion assessment, is necessary to pass this last portion of the Step 1 measure. Let's review the data element description and the allowable values. The definition. Documentation indicating that a repeat volume status and tissue perfusion assessment was performed. The suggested data collection question. Was a repeat volume status and tissue perfusion assessment performed within the specified time frame? And the allowable values? Value 1, yes. Repeat volume status and tissue perfusion assessment was performed within the specified time frame. Value 2, no. Repeat volume status and tissue perfusion assessment was not performed within the specified time frame or unable to be determined. So what is the specified time frame? The specified time frame begins with the crystalloid fluid administration date and time and ends 6 hours following the onset of septic shock date and time. In this example, we would be looking for the assessment to be performed between the fluid administration time of 10:59 through 6 hours following the onset of septic shock, which would be 2 p.m. Let's take a look at acceptable documentation examples from the specifications manual. I did the sepsis reassessment. Review of systems completed. Patient remains hypotensive following 2,000 cc's lactated ringers. In addition, you might see reevaluation, blood pressure improved following fluid administration, or 12-point ROS, there's your review of systems, except as noted. Another way that this data element can be met is provider documentation that they performed or reviewed 5 of the 8 parameters. Arterial oxygen saturation, capillary refill, cardiopulmonary assessment, peripheral pulses, shock index, skin color or condition, urine output, and lastly, vital signs. Evidence that one of the following tests was performed: central venous pressure and or central venous oxygen saturation, echocardiogram, fluid challenge, passive leg raise, is acceptable. The testing and the results can be performed by a qualified staff member, such as an RN or echocardiogram tech. However, a provider needs to attest that the testing was reviewed within the acceptable time frame. Now that we've reviewed the requirements to meet this data element, let's take a look at an example. Here's the question. Was a repeat volume status and tissue perfusion assessment performed? Septic shock was documented per MD on 1/2/23 at 10:45 in the morning. There's an order for 2,500 cc's lactated ringers over 60 minutes. This is the full target volume for this patient. The full target volume of 2,500 cc's was administered between 11:35 and 12:45. So how do we tackle this? First, we need to determine the acceptable time frame to perform the reassessment. Since the septic shock was at 10:45, we need to keep that in mind. The fluid administration time started at 11:35. So when we calculate this out, we would be looking at the fluid administration start time at 11:35 through 6 hours following the septic shock presentation, which would be 4:45 p.m. in the afternoon. Review the specified time frame to determine the earliest time that the acceptable documentation needs to be present. We've determined that specified time frame is 11:35 through 4:45 p.m. So let's look at this example and see what has been happening during this time frame. A central venous catheter was inserted by a CRNA. At 12:55, she documented this in her procedure note. An echocardiogram was ordered at 11:55, and the MD documented the result at 3 p.m. in his note. So let's review what times we have here. We have an echo order at 11:55. We have the first CVP at 12:55, and we have an echo result at 3 p.m. In addition to the testing that we just discussed on the previous page, at 11:50, the intensivist documented the following physical exam: vital signs, a full respiratory thorax and breast exam, a full cardiovascular exam, capillary refill exam, musculoskeletal and neurological exams. Now we can put all of this together. So we know that the specified time frame is 11:35 to 4:45 p.m. What's the question now? What time was the repeat volume status and tissue perfusion assessment performed? So we're going to look at those times that we collected along the way. 11:50 when the MD documented the physical exam? No. The physician documentation only included 4 of the 5 elements, so that is incomplete. We would not use that time. The 11:55 is a no. This is an echo order. We were looking for an echo that was actually performed. The documentation that an order was written does not qualify. So 12:55 is the yes. That would be the time. This is the earliest time that the repeat volume status and tissue perfusion assessment was performed. The CRNA is a licensed provider. The CVP was documented within the acceptable time frame. The echo result at 3 p.m. is the latest, so we would not use that. So there you go, the perfect outcome for a septic shock scenario that passed all of the data elements through to the end. Before we wrap up for today, I just wanted to go over a couple of takeaways. Anytime a patient meets clinical criteria or provider documentation for septic shock, fluid administration is required and a repeat volume status and tissue perfusion assessment will be necessary to pass the final piece of the SEP1 measure. Remember that the acceptable time frame for the assessment is at the start of crystalloid fluid administration and ends 6 hours following the onset of septic shock. To determine what defines the acceptable documentation, please use the version of the specification manual that applies to the discharge date of cases in review. Abstract the earliest date and time of a completed assessment. Please refer to the following resources. Thank you so much for attending today. I really appreciate it. Happy abstracting.